Yo, welcome in all you DPC rebels and resistant fighters. Dr. Shane back with another Friday 5-minute magic tip. Hope you guys are doing great. Had a great week. Looking forward to an awesome Thanksgiving coming up. I'll try to jump on real quick next Friday. I might be too full in the belly, too much food, too much sleep. Try to jump in and give you a little tip and update next week if I have some time. But I'll definitely get back sometime in December for sure. Looking forward to some hanging out with some family and friends and good food, maybe watch a little bit of football, and I hope you guys are too. I just want to share a little quick tip with you today as we move into the holiday season. I don't know if you've been spending time on social media or watching the news or anything like that, but there's a lot of rumblings out there about direct primary care, the cost of healthcare, the cost of insurance, losing subsidies, people are dropping insurance. More and more employers are looking at direct primary care or other alternatives. Seeing a lot of DPC clinics across the country that are getting more and more contact from new patients and new employers seeking their help. So there's a lot of movement and motion going on in the direct primary care community. So I've been talking about getting ready for that. Are you ready? Have you thought about adding extra space, whatever you need to do? Um, Today, I want to give you a little warning, a little heads up. Two big issues I want to cover if you're going to work with employers. When I'm saying larger employers that usually have some kind of insurance plan attached to that DPC program. So if they're more than 50 employees and they're working with some kind of insurance organization, whether it's self-funded or a BUCA plan or partially funded or some way, they have other insurance that goes on top of the direct primary care. If you're working with those employers, two big things that you really need to dive into before you sign that agreement, before you agree to take care of their patients. These two critical issues you need to nail down. You need to sit down with the benefits advisor or the broker and preferably the employer, the CEO, the owner of the company, whoever's in charge, HR, CEOs, the big wigs from the company, you, an employer, and that benefits advisor really needs to sit down and hash out these two things. There's other stuff you need to think about too, but these are two critical ones that you need to figure out as you move into the uh, dealing with these employers, signing a contract before you get too far down the road. So, two things: how do referrals work, and how will the pharmacy benefits plan work for the employees? Those are two really critical issues. So, referrals, we're talking about referrals to specialists, imaging centers, surgery centers, procedure centers, anywhere you may have to refer somebody to, physical therapy, that kind of stuff. How do referrals work? Um, are they going to make you jump through a bunch of hoops? Do you have to meet with a medical management team to say if that referral is okay? Could it take days? Are there specific places they want you to send those referrals? Like, we want all imaging to go to this place. We want GI testing, uh, uh, such as colonoscopies, for screening to go specific places. You need to have that conversation on how referrals need to be handled. If they have a specific way they want those to be done, specific procedure, where they want those testing done. Hopefully, they'll get your input on that, where the cost-effective places are in your community. But you need to figure that out, or you're going to be in a big, deep mess dealing with referrals if you don't have a good handle on that. Number two, second big thing is how the pharmacy benefits plans and the PBM works for this company. So who are they using for the PBM? How does that work? How are they going to handle brand name medications for their employees? Think about COPD or asthma inhalers, which can be $300-400 a month. How about certain brands of insulin, brand name insulins? How are those going to work? And the other huge one is GLP-1s, for diabetes, for liver issues, metabolic syndromes, sleep apnea, weight loss. Their GLP-1s are doing great things for diabetics and metabolic issues, and a lot of patients can benefit from them. How is that employer going to cover the cost of those? Are they going to cover the cost of them? Is it going to be mail order? international mail order, how's that going to get worked out? What kind of hoops do you have to jump through to get those things done? Are you going to have to do prior authorizations? That's a huge part of the PBMs. What's got to be prior authorizations? What's got to be step graded? Like, hey, you can't get a GLP-1 until they fail metformin for 6 months. What are the rules? What are the things they want you to do in the pharmacy benefits? How can you help them kind of get through that system? Those are the two huge issues: referrals and pharmacy benefits. You need to nail that down before you agree to take care of these employees, because you could find yourself in a deep, deep hole and a big, big mess, feeling like you just went back into the insurance system again. The insurance broker or advisor, whoever's setting up this plan, really should have you involved at the beginning. You should sit down and understand how this is going to be set up, how you can benefit, help them in these referral patterns and with the medications. What is the plan there? How can you work together to make it easier? If they do not get you involved, if you have not had that conversation, if they don't ask you to have that conversation, if they are telling you, oh, don't worry about it, it'll all be fine, this is deep, deep trouble, big red flags, and you need to be very concerned whether this is going to be an employer that you can work with. It may not be worth the headache to take on 100, 200 of these patients if you are spending 10, 20 hours a week trying to deal with referrals and prior authorizations and a bunch of crazy stuff. You don't have the time or staff to handle those things. So please figure those two big issues out before you move ahead with employers. They should really get your expertise involved in helping them figure that out in some way for your community. So hopefully those two big things will help you. So think about that when you're working with employers. I'm definitely happy to help. You can connect with me at drshane at dpcmagic.com, drshane at dpcmagic.com. And then if you want to send me an email, connect with me, I'll be happy to chat with you and get some information. I'll put the email link down there for you. Hope you guys have a great Thanksgiving. Hope these little tips are helping you. And we're coming up fast on the end of the year, so get yourself ready, DPC champions. Until then, you guys keep the DPC magic going.